All right, good afternoon, everybody joining us live on Facebook. I'm Karen Lair with Idaho News 6, and today we're going to be talking about burnout. It's been a really long year, and a lot of people may already be experiencing it or on the verge of burnout. So, we are going to be talking about how to spot it, how to treat it, and how to prevent it. So, we do have a panel of local experts and professionals joining the conversation today to help us out. So, first, from Regents, we have Behavioral Health Medical Director, Dr. Hossam Mahmoud. Thank you for joining us. From the Department of Health and Welfare, we have COVID-19 Crisis Community Resource Specialist, Lillian Toomey. And from St. Luke's Health System, we have licensed clinical social worker, Allison Burpee. So, a big thank you to the three of you for joining the conversation today. And we do look forward to hearing from your expertise on this topic. And a quick note for those of you who may be joining us live and watching us as we go on Facebook, you can also join the conversation and type in some questions or comments live on this Facebook video. And we'll do our best to read those as we go and answer any questions you may have. So, first things first, let's talk about what is burnout. So, Dr. Mahmoud, if you want to start us off, how do mental health professionals define this and how common is it?
Yeah, absolutely. So burnout is best thought of as a state of physical, emotional, or mental exhaustion, or all three of the above, that is typically caused by a prolonged exposure to stress. I like to emphasize usually that burnout on itself, it's not a medical condition, but rather a syndrome or a collection of symptoms.
Okay. Is this something that would be considered more acute or chronic?
It's more of a chronic condition. It is a chronic condition in the sense that it develops gradually after prolonged or while going through a prolonged period of stress. So it's not something that happens overnight, but rather it's something that almost creeps up on you, and that is one of the reasons that make it so difficult to identify early on.
Absolutely. So, Allison, I'll have you jump in here. What are some of the symptoms of burnout that people should be looking out for, and do they appear or present differently for different people?
Absolutely. They do present differently for different people. And in this context, I think when we think about burnout, that can look a lot of different ways. Uh, like Dr. Mahmoud, am I pronouncing that correctly? He said it's physical, emotional, psychological, and absolutely it can be all three of those things or one of those things individually. It can look like fatigue. It can look like foggy headedness, um, difficulties in engaging, and that can be at work, that can be at home. Um, it can be physical in terms of oversleeping, undersleeping, hyposomnia, hypersomnia. It can also be overwhelmed very easily. And so that's something that we can all relate to, particularly in this context, is just this feeling of balls flying past us left and right and really struggling to catch them. Um, those can be signs and symptoms. So again, physically, it can look like overeating, undereating, oversleeping, undersleeping, difficulty exercising, fatigue, psychologically, trouble connecting with those that we love, those that we typically have an easy time connecting with, just a challenge in really engaging there at work or again at home. And then psychologically, just that fog of trouble concentrating, trouble prioritizing, feeling that we are being very passive and in our own lives. Those are all can be symptoms of burnout.
And is there like a time frame? Because I know a lot of people that maybe are hearing this, like, check that off, like, oh, yeah, I've definitely felt that at some point over the last year. But is there a certain length of time that, hey, if you are continuing to feel these things for X amount of days or weeks, that maybe, this is burnout and not just typical stress?
Well, I think the way I would answer that, the way I would address that is one of the things that I talk about with folks that I serve that are experiencing burnout, wondering what it is okay, if we focus on what we're needing, what we're not getting potentially, and that still doesn't help the issue, then we might know it's time to reach out and get some help. Unfortunately, with burnout, in terms of the timeline that you asked about, it can lead to other more serious and chronic mental health disorders like major depressive disorder, anxiety disorder, etc. It can lead to those. It certainly does not always lead to those, but it can. And so the timeline piece is important, because if we've made some behavior modifications and tweaked some things and we're still not seeing any improvement, and that timeline gets elongated, it's all about patterns, and we want to terminate those unhealthy patterns. And when we struggle to do that, the chronicity of the burnout can lead to more significant issues down the road.
Yeah.
Absolutely.
If I may just follow up on 2 points that Ms. Purpy made that I think are so important to highlight, because and I'm so glad that you mentioned that burnout does not just occur in the workplace. Historically, the conversations about burnout had been almost exclusively in the context of occupational health or stress in the workplace, but that is not the case. Burnout can occur in a wide range of situations and contexts. And one example that most of us are living through is COVID, and that kind of constant fatigue that we feel in response to the COVID pandemic itself. The other point that I do want to highlight is that there are definitely kind of risks associated with burnout, in the sense that it can devolve into more serious mental health conditions, but it can also compromise physical health as well, with significant muscle tension, headaches, dizziness at times. And it's been recognized as a risk factor for developing high blood pressure and certain other conditions like diabetes.
Okay. Well, Lillian, I'll have you jump in on the conversation here. We've obviously, as we discussed, had so many different things going on in this country over the last year, and there's still a lot of uncertainty as we're moving forward. So what kind of factors are you seeing that are contributing to burnout for Idahoans? As we mentioned, it's not just work, right?
Absolutely not. And just to preface this, I'm not a clinician. My work is a resource specialist. So I work with people on emotionally supporting them and helping connect them to things that they may need. And a lot of what I've been seeing is that sense of uncertainty where people may have initially experienced kind of this surge of heroism around healthcare professionals and those who have been helping us combat the pandemic. But it's 14 months on, and as time goes by, there's this sense of disillusionment that kind of creeps into the community, and that threat has not been like an acute or immediate threat that we can take action to prevent necessarily. It's been something that's very nebulous, very hard to define for people, and that prolonged uncertainty around how may I contract this virus, how might my loved ones contract this virus, has just contributed to a lot of difficulty for people. And the other thing I would add is there's a sense of disconnection, because not everybody has experienced the pandemic in the same way. That can lead to a sense of disillusionment, to polarization, just to a lack of community cohesion.
Absolutely. I think we probably all agree with that. Everyone kind of has their own perspective on a lot of different things that have happened over the last year. Now, when we talk about people who are experiencing burnout, Dr. Mahmoud, is this something that could go away on its own if it's not treated, or is there a certain time or symptom that people should really be going to get some professional help?
Yeah. So what I would say, I would say as long as the factors or stressors contributing to burnout persist, it is very unlikely that burnout would resolve on its own. Now, there are certain symptoms that we should all look for that would alert us that we definitely need to seek professional help. But I think when it comes to burnout, we first need to think about the factors and try to mitigate the factors and see if we can modify the factors, if we have any control over the factors contributing to burnout. Because at times, changing that environment or changing that dynamic might be helpful. But if someone's starting to feel depressed most of the time, low energy, low motivation, not feeling hopeful, having panic attacks, for example, it is likely time to seek professional help. For milder symptoms, there are some options, including speaking out at work, especially if you have a workplace that is supportive, that creates kind of a safe environment to be able to talk about mental health and well-being, to try to modify some of the stressors. Other options include using these self-navigated applications that have become increasingly available over the past few years to help with building resilience and combating stress. But if you feel that the symptoms are not improving or deteriorating, then it's time to seek more professional help.
Absolutely. Allison, did you want to jump in on that at all? If people are trying to maybe brush this under the rug or expect that maybe these feelings will get better eventually, what would you want to say for those people?
I agree with Dr. Mahmoud. I think it's important to point out that fundamentally these things do not, so they don't resolve without some behavior modification, without some change of some sort, and that can look a lot of different ways. So I serve folks in an outpatient behavioral health clinic, and so one of the things that I'm always talking to my folks about is some introspection, some insight into what are we needing that we are not getting, particularly in this year where we have been overwhelmed and underwhelmed all at the same time. We have too much of family, potentially, not enough friends. We have too much work, but not enough necessarily support around that work. We have too much and not enough of so many things that balance is really something that is hard to access right now for folks. And so what I talk to folks about is that balance. What might you be needing that you're not getting? And let's try and get some of that. How do we claw back some of that competency around seeing a friend once a week, getting a little bit of exercise, not sleeping during the day so you can sleep potentially better at night, these types of things. And the behavior modification, sometimes a little bit goes a long way to introduce some momentum, some wind at your back. And sometimes these things do resolve. And again, like Dr. Mahmoud said, sometimes they do not. But that's the piece. I love that he pointed that out, the piece of recognition of what's going on and seeking some support in some way, whether it's from a friend, a family member, a clinician, potentially, but recognizing, okay, here I am. What change do I need to make realistically? Because these things don't just resolve if there is no modification put in place.
Absolutely. Well, Dr. Mahmoud, if someone may be either experiencing this for themselves or, maybe they're hearing this conversation and they're thinking of, a loved one, a family member, like, oh, hey, I think that's what's going on with so-and-so, what kind of signs can they be looking out for in their loved ones that may indicate that they are dealing with burnout?
Yeah, and nowadays it's so important to highlight this, because with the physical distancing that we've experienced over the past few months, it's gotten more difficult. I think it's important to look out for these signs and symptoms to be there for our loved ones. So one thing that I urge people to always look for is this kind of constant feeling of being overwhelmed, as well as a sense of cynicism.
Mm-hmm.
One other area to look for, or one other symptom to look for, is a sense of numbness or detachment that we can pick up on, because we heard earlier from Ms. Burpee that the people feel detached or uninvolved, and I think we can sense that among our loved ones. So it's important to look out for these factors. And at times, if you suspect that someone you care about is experiencing burnout, it doesn't hurt to ask and just remind them that you're there for them if they need to talk. I think it's important for us to really build that social solidarity, especially during these times of perpetual crises that we're living in over the past few months.
Totally. Allison, if you want to chime in, if there's maybe some ways, and we kind of discussed this earlier, but ways to differentiate or distinguish between maybe simple fatigue or normal level of stress? Like a lot of people might feel maybe work related if they're working on a big project or a presentation, they may not have a great night's sleep. But what's kind of the distinguishing difference between that and burnout?
Good question. I think, again, it can look a lot different ways for different people, but what I would what seems paramount in my mind in terms of differentiating those two is when we are tired and stressed out, we can typically rest and recover, and we feel a bit better. We might not feel like we're 21 again, but we can typically feel better. We might have familiar relationships that we're struggling with. I know, again, like Dr. Mahmoud said, so this context for burnout has been in a professional umbrella for so long, and it's become a buzzword, and we know that we are multifaceted people. We are multidimensional people. We don't change when we leave the office and go home. It can be that we have protective factors at work, that we're able to sit down in an office and be very competent, very efficient, have dialogue, communicate well, and then when we get home, that's when we melt down and start to feel that emotional detachment. And so simple fatigue, with rest, diet, exercise, these things, it improves. With burnout, like Dr. Mahmoud said, there's an emotional detachment component to it, and that cynicism, that negativity of your surroundings, that is important. Rest doesn't necessarily change that. It could overnight. On a day that I'm not well rested, I come into the office and there might be there might not be rainbows everywhere, but a good night's rest or two improves that. This kind of more chronic, more persistent cynicism, skepticism about your work environment or your family system, that is the difference. It's more pervasive. It affects you more deeply, and you don't bounce back like you would if you just need the rest.
Now, you mentioned kind of, some differences of being in the office, leaving, going home. For a lot of people right now, that is all very blended. And some people are working from home, like I'm in my home office right now. So Lillian, if you want to jump in here, for people that, and a lot of companies are making the decision to continue having their employees working from home, either from here on out or for at least a few more months. And it's already been more than a year for a lot of people. So what are you seeing, Lillian, and what advice would you offer for those people who are having trouble balancing work life and home life when it's all in the same room together?
Yeah, I think it's good to check in with and know yourself and know how you work. Are you someone who thrives on that like integrated multitask environment where you're doing multiple things at once? Or do you really need clear boundaries and clearly segmented parts of your day when you're doing different things? And then set yourself up for success if you decide, I want to have a section of the day where I'm dedicating this to disconnecting from work and not being on my work email, then just make sure that you are able to be successful, whether like that could be look like putting your phone in another room, or just making sure that you have a way to help yourself achieve that goal that you want, if that's something that you need. But yeah, just knowing yourself, connecting with what's important to you.
Did either one of you want to chime in there? I know a lot of people are kind of in this boat right now, working from home, and it can be a lot every day.
Yeah, sure. I could say a few words on that. In my experience, a lot of folks I talk to, including some patients that I do see, kind of struggle with creating that boundary between work and home, and they, especially if they've had that challenge in the past, it is more forefront right now as they work from home. And so what I advise usually is that if you are able to have a home office, if your place is big enough to have a home office, then it's important when you're done with work to leave that home office and not go back, and even close the door, turn off your computer so you're not tempted to either check email or do other tasks related to work, to try to make that emotional and mental disconnection from work. One other area that I don't think it's talked about enough is, I think at times when we work from home, sometimes our families get the impression that, we might not be working as much. And so I think it's important to have very honest conversations about household tasks and responsibilities. Because you're working from home does not mean that you have time to also multitask all the time every day. And so I think it's important to communicate these boundaries, these responsibilities, and the distinction between work and home, as well as kind of the delineation of responsibilities in the household.
Good advice there, for sure. Allison,
May
did you
I
want to
add
chime in?
something quickly?
Yeah.
I think, again, I think that this conversation can so often be perceived as the responsibility of the employee, the responsibility of the person. And I think of it twofold. I also think it's an important conversation, an important responsibility for organizations and employers. I think ideally, and I know that this is harder in practice than it is to discuss right here, right now, but the importance of having intentional conversations with our leaders, with leadership, with those that we report to, around, hey, around expectations of during what hours are we available? It's my expectation. I see emails being sent from you to me at 10 p.m. That gives me the impression that it's also that there's an expectation that I be replying to those emails. Let's talk about intentions, particularly if folks are going to be at home like they are so often. I think it's really important to have those tough but intentional conversations with employers and leaders around expectations. I know for me, when this first started 14 months and 2 weeks ago, when I was at home, I didn't have the same rituals in place around finishing my workday. So when I'm at the office, I have rituals and routines that to me are imprints mentally that a workday is over. I go home, and my workday is over, and then I'm home. I have rituals and routines around entering back into my home, and those were delineated very cleanly. When I was at home, those rituals and routines were not in place. I struggled. It took me many, many, many months, and I still have work to do around those rituals and routines. And I would find myself checking my work email, checking my phone for work in the evening because I hadn't established those rituals and routines. I never was satiated. I just never felt like I had that closure. And so that's a different way to look at it as well.
Definitely. Go ahead. Did you want to chime in again?
Yeah, I do want to emphasize, and the point that you mentioned is that employers really set the tone, have a huge role to play, because they set the tone for wellness, for conversations about wellness, for destigmatizing conversations about mental health and well-being in the workplace. So I just agree with your point.
Now, what would you say, though, for somebody who maybe feels that their employer would not support that, and they are worried about coming forward to say, hey, this is too much. Like, I need, a break, or I need some help with some of this. And what if they feel that they may not get the support that they need, or could even get fired for something like that?
That is definitely a difficult situation to be in, and it's likely a kind of situation that's contributing to burnout itself. That is a tough situation to be in, to feel that if you were to speak out, that there would be kind of negative consequences.
Well, then I guess let's talk about some of the things that are out there. Lillian, I want to bring you into this. So I believe recently you were involved in like a series of virtual support groups going on that Idahoans can access. Tell us a little bit about that, and is there still opportunity for people to be getting involved virtually with that?
Yeah, so we've been doing these every 2 weeks, and they're just a chance for people to come together and sort of process the pandemic together. Like I mentioned earlier, everybody's kind of at a different place where they are in terms of COVID-19, and so we've been able to share our experiences, share what's worked, what hasn't worked, kind of just get that off of our chest a little bit. for those things that have been really challenging and really been a struggle for both the participants and us as facilitators. It's really been rewarding in that way. So we've done a lot of different topics. A couple weeks ago, I did one on ways to engage through virtual platforms. So just like strategies to use Zoom creatively, and a couple of other online tools that can help people get really involved and have a lot of fun during meetings. But we've also done some more challenging topics. We talked about just kind of processing this pandemic and what it's meant to all of us. We're going to talk next week about grief and loss. We are actually going to talk in a couple weeks after that about boundaries. And these are free, they're short, so they're an hour to a half an hour, and they're just a way to kind of disconnect from whatever's going on in terms of work or the rest of your life, and just connect with others in Idaho about what your experience has been. And the other plug I would put in is for our COVID Help Now line through DHW. It's the Idaho Strong program, and you may have seen our billboards. We're at 986-867-1073. And you can call that number to get in touch with somebody and just talk. If you are experiencing some of these feelings, or if you just need somebody to hear what's going on in your life and kind of be a sounding board for you. And we can also make referrals to mental health services as needed.
Awesome. Well, Dr. Mahmoud, you mentioned earlier some online tools that are available now. So if there's somebody who's maybe reluctant to, physically pick up the phone, call a doctor, make an appointment, see a counselor, and, maybe there's, a long waiting list, and it may add another level of stress or anxiety to it. What can people be doing now, maybe from their own home, to take that first step?
Yeah, when I think about the kind of range of solutions or services that are available, I think it's important to take a step back and just try to understand where you're at on kind of that spectrum of severity of symptoms. Because if you're having kind of milder symptoms of burnout, then there are some options, including some support groups, including utilizing some of these online applications that are self-navigated and help kind of with these skills for coping with stress, for building your resilience, or maybe kind of rethinking ways that you've thought of things kind of throughout one's life. They can help with insomnia as well. But then it's important to realize if symptoms are getting worse or not improving, then it's important to seek more professional help. And that could be in person, it could be virtually through telehealth. That could be seeing a behavioral health professional, or it could be starting a conversation with your primary care physician. So it's important to be cognizant of where you're at and kind of self-reflect a bit on one's needs in order to kind of explore the different options for treatment.
Okay. Well, we see a comment coming in from Nate asking if we're going to be sharing links and phone numbers. So Lillian, if you want to repeat that phone number, maybe Donovan can type it into the comments there so everyone can have that phone number, and then the website to maybe access some of those virtual discussion groups.
Yeah, so for the COVID Help Now line, that's at 986-867-1073. And then for our discussion groups, if you Google Empower Idaho, that's the organization we're partnering with to deliver these, Google Empower Idaho, and it will take you right to their website. You can find their calendar and then just click on the event that you're interested in registering for. And I may be able to get the link to you as well.
Okay, and it was pretty easy to find. I looked it up before our discussion. It was empoweridaho.org, and then the calendar was very easy to find with the different days and different discussions, and then a little link to register. So if anyone is interested in doing that, it was pretty easy to find. And we do have that phone number now posted in the comments section if anyone wants to call the COVID helpline. So I'm reading another comment that's coming in from Nancy. It says, what do we do when there are also no counselors available when reaching out? Over the past year, I've tried to get in and talk with someone 5 different times, and not one office has called back. And I know she's not the only one dealing with that. I've heard that from other people as well. There's waiting lists. There's, how can people get in the door if, they can't get someone on the phone? Does anyone want to chime in there? Allison?
Sure, I'll chime in because that we're experiencing that at our clinic, and that's unfortunately the demand. The demand is great and far beyond capacity, and what a difficult situation to be in. making the move to reach out for help. It's something that's difficult to do for many, and then not getting that positive feedback, not getting any phone call back is challenging. So I think what I would recommend, and what I do recommend to folks, is to call. So for here, I'm in Haley, Idaho, and I'm at the St. Luke's clinic here. We have a Center for Community Health. I think some of the ways it makes sense is for folks to, so we have a resource here that can connect people to mental health resources in our valley, which are limited and at capacity. But if therapists are full, you can reach out to this Empower Idaho would be a great resource. I didn't know about that, and I'm glad. Secondarily, typically healthcare providers have referral hubs for this, and so if a patient wants to get connected to a therapist or psychiatry, if necessary, they can oftentimes go through their PCP. Thirdly, I tell folks all the time to call the number on the back of their insurance card, or if they have Medicaid, to call Medicaid. If they have Medicare, to call Medicare, and typically they can get someone to pick up and answer, and they can be given mental health professional contact information. So your insurance provider would be a great resource to you. Call the back of the number on the card and say, hey, this is my zip code, this is where I am, what does my coverage cover, and what providers in the area do you see? And you can get that information from them.
Yeah,
And Dr. Mahmoud, did you chime in there?
Yeah, I would follow up on that. So one of the challenges that we have is not only do we not have enough behavioral health providers in the country, they also tend to be concentrated in certain geographical areas, and that makes accessing services more difficult. So one of the focuses of our behavioral health strategy for the next 2 years has been to increase availability of virtual providers and telehealth providers within our network, to make it easier for our members to access care, especially those located in rural areas, but not solely. The other aspect I want to highlight is that we recognize the importance of being able to serve members with behavioral health needs. So we've trained all of our customer service professionals on mental health first aid, to help our members navigate kind of different options for treatment depending on the symptoms that they're struggling with. So I would echo, checking with your health plan, because they likely have many resources to help direct you to care.
And is this care something that, for someone with insurance, this typically would be covered?
Yes.
Okay, so that's good to know. So as we are trying to get back to life as normal, a lot of people, are starting to maybe integrate back into the office, starting to, get a little bit more of a differentiated work life, home life. But is some level of burnout inevitable? Dr. Mahmoud?
Oh, it's so difficult to make predictions. I think a certain level of is inevitable, in the sense that there is a lot of uncertainty. There are a lot of areas that need to be cleared as we go back to a hybrid model, back to our kind of physical spaces to work. I think it is important that we're having these conversations today, that we're conversations to kind of educate as many people, let them aware there are risk factors to burnout, to look for them, to try to mitigate the factors for burnout, but also if they're experiencing some of these symptoms, to try to take action.
Now, Allison, if you want to chime in here, we'd mentioned, a couple of very tangible things that people can be doing, close that office door, put the phone down at times throughout the night. But do you have other maybe self-help steps or actions that people can take if they do feel themselves burning out from the demands that they're getting, from all kinds of different directions?
Sure. I think in short, that the issue of prioritization, one of the things that I think we are told so often is that there's so much to do and we can do it. There's so much to do, yet we can do it all. One of the things that I talk a lot to folks about, myself included, is this idea of prioritization. And if I'm going to put something, if I recognize that I'm experiencing some symptoms of burnout, then I'm going to take a look at my day. How am I spending my hours? What am I giving my focus to? And what is serving me and what perhaps is not serving me? So the things that are not perhaps serving me, I'm going to take away, and I'm going to replace those things with some more adaptive strategies for addressing that burnout. That can be self-care. We talk about self-care. We all know what it is, but self-care, I think, is greater than just eating fruits and vegetables and getting exercise and sleeping. It's also relational. It's also spiritual. It can look a lot of different ways. It's emotional. There's self-care that goes beyond the choices we make around our sleep and our diet and whether or not we exercise. And so it's recognizing what is not serving me, and what can I implement that may serve me. One of the folks I serve recently, she is having a very difficult time concentrating. She finds that she's distracted, looking around. She'll spend 10 minutes doing something, get up, walk away. She can't settle in, and there are some ramifications for her she's experiencing. And so one of the things we're doing is mindfulness work with her, how to claw back 5-10 minutes of mindfulness, gratitude, truly closing things out and being in her own skin and being comfortable there, which has been difficult. But those are the kinds of things I think we need to think differently about. What am I needing that I'm not getting, and how do I get it? And in order to get it, I have to take something off my plate. We can't continue to put more and more and more and more. When people hear, do some mindfulness, try exercising, they hear, do more, do more, do more. And my message to folks is, try taking 2 things off your plate that might be maladaptive, that might not be serving you right now, and bring 1 thing on that's different, that might be plugging that floodgate of energy and focus. Does that make sense?
Yeah, well, and I think a lot of people may not even realize what all they are dealing with in a day. Do you ever recommend people, take 1 or 2 days, like write everything down, what you're doing, when you're doing it, and look at it tangibly like that?
Absolutely. What I'm a big fan of is make a plan, not a to-do list. We just, to sit down in the morning, folks have a cup of coffee and write a 20 deep to-do list. And I'm guilty of the same thing, setting themselves up for epic fails because there's no way they're going to get through those 20 things. I much prefer a plan of 1 or 2 things that they are focused on accomplishing that day. And that can be 10 minutes of mindfulness and 20 minutes of reading with their kiddo, with the phone out of the room, with the TV off. That's an awesome to-do list right there. That is the intention behind those types of things. I think we are rallying around, and that's healthy.
Well, and even taking, the 5-minute break to step outside and get some fresh air can really do a lot more than maybe you would have gotten done in 5 minutes at your computer. Absolutely. To get a kind of fresh look, right? Lillian, is that something that you guys have talked about in some of your, virtual discussions that you've had on ways to kind of reset and do some mindfulness?
Yeah, definitely. We actually did one centered around meditation and mindfulness, and just gave people a taste of what it's like to spend that 5 minutes, disconnecting, kind of training and refocusing your brain. So that was great. And actually, my colleague is planning to do a weekly meditation group, also virtual, but he's working on getting that off the ground. He has a background in those things. And meditation and mindfulness. And I wanted to also just mention, along with the benefit navigation that Allison mentioned you can get through your insurance, Health and Welfare also has a benefit navigation line. So this can help people who have an employee assistance program and who want those, typically it's like 5 free sessions of mental health services. Or for those who don't have insurance, help them explore their options and see what's out there for them. Like you mentioned, we're dealing with lack of availability in some situations, but this line can be a really great way to just kind of make that first step. So that's the coronavirus counseling assistance for frontline workers, and frontline workers is defined really broadly on purpose. But that number is 866-536-0239. And again, that's just to get in touch with somebody to talk about what's out there for you, whether you have insurance or not, in terms of mental health services.
And that's a great resource as well. Now, Dr. Mahmoud, you had mentioned earlier the role that managers and employers play in this. So if they're having some employees that may be dealing with some of this, what role do they play in preventing burnout among their employees? And, you know, for these people that do have, you know, high stress, high demand jobs, how do we avoid burnout?
Yeah, that's a great question. Oftentimes, I think when we think of burnout in the workplace, we think about having too much work. And what my patients report to me is not having too much work, rather feeling overworked and underappreciated, as well as getting kind of a sense of lack of clarity as to what responsibilities are, what expectations of the job are, and then having some unhealthy work dynamics. So I think these are the areas that need modification, because in principle, one could take time off. And I think it's very important for people to take time off and enjoy their time off. But taking a day or two off from the workplace is not going to solve this chronic issue of burnout, because the factors are there and will be there when you go back. So I think these are the other areas that employers need to focus on creating a more positive, more supporting work environment, a work environment that supports employees in succeeding, kind of appreciates them, and communicate very clear expectations, which we allude to earlier on, as to what is the expectation after hour. Are you expected to check your phone at 10 at night if we're sending you emails at 10? Or is it, that you're getting these emails with the understanding that you will respond to them when you go back to work the next morning? So these are some of the areas that are important to emphasize and try to improve on within the workspace.
And just to do kind of a little recap, we may have some new people that are joining us now that weren't here at the beginning of the conversation. So Allison, if you want to kind of go over again those key indicators that would tell people that maybe it's time to take that next step and get some professional help with symptoms of burnout.
Yeah, so I think in terms of symptoms of burnout, what you want to be looking for is that detachment, that emotional detachment that you're experiencing with family, friends, work, that is not improving, even with behavior modification, that it still is not seeming to improve. So yeah, emotionally, that detachment, that sense of we've all had it intermittently. It's situational at times, but that trouble engaging, that trouble being present truly at work or at home or in the different environments that you find yourself. Physically, I think that real chronic fatigue that doesn't improve with healthy diet, good sleep, some exercise. When we modify behavior and we don't see improvement physically, that's when we know that there's something underlying. And again, like I said, too much sleep, not enough sleep, eating too much, or reduced appetite. And then psychologically, kind of this fog is what I call it. Trouble concentrating, the difficulty. I've had folks say to me that in the last year they have sat down to read a book and struggled to read top to bottom one page. Just this fogginess, inability to concentrate, start something and complete something. Those would be signs and symptoms that I'd be looking for.
Okay. Well, if anybody else who's watching right now has any other questions, feel free to chime in and put those in the comment section, and we'll try to answer those. But otherwise, I'll give each of you kind of an opportunity to kind of give your closing thoughts and kind of key takeaways that you want people to keep in the front of their mind when they're thinking about burnout and what next steps to take. So Dr. Mahmoud, I'll start with you. Your key takeaways from today.
Yeah, first of all, I want to thank you for having us on for this very important topic. I want to remind folks that this month of May, is Mental Health Awareness Month. And I think it really is an opportunity for us to highlight the importance of our mental health and well-being overall, combat the stigma associated with having these conversations and the stigma associated with seeking care. That's why it's so important to be discussing well-being and burnout, not just this month, but I think this month is a great opportunity to focus on these areas. So thank you so much.
Yeah, absolutely. And thanks for joining our conversation as well. Allison, any closing thoughts or key takeaways?
I agree. Thank you for having me. It's been a pleasure. It's nice meeting the three of you and all of those that I can't see. Again, the stigma piece is so true. And I think when in doubt, we struggle to be vulnerable. It's something that is real. And this last year has really made that clear. It is difficult to be vulnerable, particularly with those that we wonder if they've experienced this before. We wonder if there's going to be an overreaction. But I would ask folks to consider sharing when you are experiencing these symptoms of burnout, when you're feeling unlike yourself, when you feel like you need some support, to look around you, get a sense of your support system, what that exists, what does that exist of, and to be vulnerable within that system, to share what you're experiencing, to share struggles. Oftentimes I feel, me personally and the folks that I serve, there's just as much empowerment in sharing a struggle oftentimes than the feedback we get back. It's that sharing that empowers us, and that's very, very important. I know it's a difficult thing to do, but like Dr. Mahmoud said, the stigma around these mental health issues, burnout being a low level potential issue that can bleed into bigger, more chronic issues, the importance of verbalizing those things is vital. And I think the more we do that, the more that we will all be aligned.
Now, Allison, you mentioned the importance of sharing that, but what if someone shares that with you? What is some helpful feedback that you can do to support a loved one that may be dealing with this?
That's a good question. And I think potentially there's a million different answers. I am a big proponent when folks ask me that, when I'm serving family systems and kids go to their parents with issues around drugs and alcohol, or parents go to with any sort of communication around tough stuff. I would ask folks to remember that they don't need to have answers. They do not need to have the answers. In fact, they most likely do not have the answers. Ideally, they listen. They listen with unconditional love, with respect and validation, and that is what they can do. They can listen. They don't need to have these resources that we discussed this hour. They don't need to have answers. What ideally they do have is a true listening ear and the ability to listen and validate. I hear that. I hear that. I hear that.
And that's definitely helpful. And Lillian, did you want to share any kind of closing thoughts or reminders on, there are resources out there?
Yeah, absolutely. Thanks for the opportunity. And yeah, I think Allison said it very well in terms of just trying our best to seek help when we need it and to connect with others when we need it and to use those resources that are available.
And we did share a lot of those in the comment section here. So there are phone numbers, there are links on how to kind of get the ball rolling. So thank you three very much for joining this conversation. Hopefully it was valuable to some of you who are watching at home. And just so you know, when we do finish this live discussion, this video is going to stay on our Facebook page along with the comments and resources there as well. So if you missed a part of the conversation or you want to share it with a loved one or a family member, you can still find this on our Facebook page. Just search for Idaho News 6. So thank you all so much for being with us, and I hope everyone has a great rest of your day.
Thank you.
Thank you, Karen.